So back in 2005-2006 there was growing public concern about the safety of maternity services. There'd been a number of high-profile cases in the media. We decided that there was an opportunity for us to launch an independent inquiry into the safety of maternity services in England. Under the chairmanship of Professor Onora O'Neill, we had a panel, not including midwives or obstetricians, but people with experience in patient safety, in healthcare regulation and in quality. And in 2008, the King's Fund published a report, which was the findings of that inquiry. They concluded that overall care was generally safe, but there was much more to do to make sure that every woman could experience safe care. One of the areas was team working and communication. Particularly in maternity services, there are quite a lot of handovers. Women are in labour over quite a long period of time. Sometimes there have to be transfers from the community into hospital or from midwife-led care to more high-risk care led by an obstetrician. The other area was around training. Not only having protected time for training, but training as teams and training in the places where people work. The other area, and there's been a lot of discussion even more recently about staffing levels. And the inquiry was quite clear here that whilst that is important, it is as much about how the staff are deployed, so where they are spending their time, the rostering to meet the peaks and troughs of demand on the service. The other area they made recommendations was around guidance and information. The maternity teams that presented to the inquiry said they're overloaded with guidance about what's best practice. And so the inquiry recommended that there needed to be much shorter, clearer guidelines, protocols, particularly again in emergency situations. The final area was around information and having a few measures to help them know how they were doing. Again, lots of information, lots of form filling, but not really information that was useful for them to know how they were doing in terms of safety. And it was these recommendations that led us to set up an improvement programme where we helped 12 maternity teams across England to work on some of these areas. Going into the improvement programme, we were very clear that this needed board level support and that members of the board needed to be more visible in championing patient safety and being present and understanding how things are on the ward level for those working in maternity services. A lot of them were reinventing the wheel. They saw a problem and they very innovatively came up with their own solutions. But we identified that actually there are quite a number of tools that have been developed not only nationally but internationally, that we felt the teams could learn and adapt for use in their local context. So for example, in focusing on communication, we encourage teams to use a tool called SBAR, which is a structured communication tool.
They'd all learnt really amazing things about how to improve the care that they gave to mothers and their babies. We were able to capture some of those lessons. We were able to support maternity teams to embed the changes in their clinical areas, but also to disseminate the lessons further afield throughout the NHS. Our hope is that the resource toolkit will be used wider than the maternity teams, but across the country to help improve safety in maternity.